Hello, my name is Dr. Joe Childs. Thank you for visiting our site on migraine headaches. If you suffer from migraine headaches, you know how impactful they can be on your life, how frustrating they can be for somebody that is suffering with migraine headaches, whether it's you, whether it's a loved one, how they can affect your social life, your time with your friends, how they can affect your progress at work, missing days of work, your success at work. Migraine headaches, tension headaches, especially if they're chronic and weekly or daily for some people, it can really affect a person's life. When I was younger, my mother used to suffer from migraine headaches, and what I would notice is they would always come on at unopportune times, such as during the holidays when we were having friends or family over. What would happen is I would notice my mom wasn't feeling so good, and next thing you know, she's in her room in a dark bedroom for the whole night, sometimes the next day. And I used to hate that. It would be terrible because what happens is migraine headaches really take a big chunk of your life out. They affect you dramatically. So if you're suffering with these things, I want you to understand that I have an understanding from treating so many of these patients what these people are going through, people that suffer with migraine headaches. Now, what I'd like you to consider is, are you getting at the root cause of the problem, or are you just taking medications to mask the symptoms? Are you just taking this drug, that drug, trying this one and this one, trying different cocktails of drugs, different types of medications, trying to reduce your headaches? Are you feeling like it's not working so well? And typically when we hear this, we see lots and lots of patients with migraine headaches. Typically they're not going to a doctor who is looking for the true underlying cause of the problem. That's what we do differently in our office. We look for the underlying cause of the problem. Research has shown that migraine headaches and chronic tension headaches are caused by misfirings in the brain, particularly the brainstem itself. The brainstem is the seat or the area that controls all of your what's called autonomic function. Patients with migraine headaches function with or have autonomic dysfunction. So in your brainstem there are nuclei that control blood vessels to your brain. And when those blood vessels are not functioning well, they may swell, they may stretch, and they may affect free nerve endings. And most people take medications to alter the effect or constrict those blood vessels. The problem with that is the majority of these people have what's known as rebound headaches. So if you're taking some of the most commonly used medications for migraines, you end up with rebound headaches. So not only do you have the headache itself or the migraine itself, you get 2 or 3 headaches afterwards. So what we do differently is we do something called functional neurology, or what's called drugless neurology, to affect the areas of your brain. We can affect certain parts of the brain that cause headaches without drugs. We can use specific neurological stimulations to make those areas function better, to alter the physiology and improve the physiology or bring it closer to normal so that you have normal blood vessel function or more optimal blood vessel function. We also combine functional neurology with something called functional medicine or nutrition. So what happens when patients get migraines is, it's kind of like, and I like to explain it this way. Imagine you have this bucket. It's a trigger bucket, so to speak. And there is a threshold. Every person has a threshold. Even somebody that doesn't get headaches very often or at all, there is a point that bucket will become filled where they're going to get the headache. And we call that the threshold. People with migraines have a very low threshold because their nervous system is sensitized. So in the bucket, what's happening is the lower the threshold, the least amount of triggers you can take. So triggers can be things such as stress. They can be things such as changes in the atmospheric pressure. You hear people say, well, it's going to rain today. I get migraines when it's humid, or I get migraines when it's really hot, or I get migraines when it's very cold. It's different for everybody. But that's a trigger. Stress is a trigger. Those are two things you have a hard time really dealing with. I mean, obviously you can do things for stress. Then there's foods that can be triggers, food sensitivities, different types of migraine triggers, such as chocolate, such as beans, such as patients that have citrus fruits, things like that. And so what happens is once those triggers get to a certain point, boom, you have a headache. If your threshold is really low, it doesn't take very much triggers. You may be living this close to having a migraine every single day, and you put one more trigger, one more stress, one more thing like that, bam. So what we like to do is we like to nutritionally decrease the triggers with anti-inflammatory types of care, anti-inflammatory diets, anti-inflammatory supplements, and we like to address you neurologically and structurally, improving the parts of the brain that we just talked about to make your threshold so far away that you can handle all these triggers. So that's what we do. So getting back to the nervous system, when we look at the nervous system, we know that there's areas in your brainstem, one of them being the trigeminal nucleus. It stretches from the upper brainstem all the way down into your neck or cervical spine. When that area is unstable, it can really cause dysfunction in the blood vessels. And there's things that you can do, such as oxygen therapy. We use that in our office. We can do specific types of eye exercises, specific types of stimulations to make those areas in your brainstem that control the threshold of you having a migraine more stable. And at the same time, we can affect you nutritionally to reduce your triggers. And what we notice there is we notice that people have less and less headaches. Whether they're tension headaches, whether they're migraine headaches, our program is highly successful. This is just a short video. I don't have the time to sit down and explain everything in complete detail as far as what exactly we do to help patients with migraine headaches or tension headaches. You can see on this website there are testimonials of some of the hundreds of patients we've helped overcome headaches without drugs, without anything very, very invasive. We do drug-free care. It's nutritional and it's neurological, drug-free neurological based care. So if you want to learn more, or you would like to have a free consultation in our office, you can call us today. Our phone number is right here, or you can put your name and information in the box on this website, and what you can do is we'll send you more information on our free consultation. And when you come in for our consultations, our free migraine or tension headache consultation, we'll sit down, we'll explain exactly what it is we do, we'll sit down and listen to your certain set of migraine symptoms, because every patient with migraines is a little different than the other. We'll find out how it's affecting your life, we'll find out the frequency that you get them, we'll find out what the triggers are, and then we'll explain to you what it is we do, and we'll let you know exactly what may be a potential solution for you. All of that is free. We do a free consultation. It takes about 45 minutes to an hour. So if you would like to take advantage of our free consultation, just give us a call. The number is on this website. Thank you very much for listening, and we look forward to seeing you or any of your loved ones that are suffering with migraines or tension headaches very soon. Thank you very much.
Jennifer, what health complaints did you have prior to coming into the office?
Well, originally I came in because I had injured my neck working out and had a lot of pain, couldn't turn it easily, it was very stiff and uncomfortable. And then I also came because I've been suffering from migraines for several years and had about 10 or more a month that I was dealing with.
Okay. How long did you suffer with that?
With migraines?
Yes.
Ever since really I had my children, I had migraines, and they had gotten progressively worse to the point that I needed a prescription medication to deal with them every month.
Now, how did your neck pain and your migraines affect you in your life as far as your time and your happiness?
They were very painful and debilitating in a lot of ways. Part of my job is being on the computer, and I could only be on there for a couple hours before getting distracted by the headaches. I needed to take medication for them. They had gotten so bad. A lot of times I needed to lie down. I needed to be in a dark room. I couldn't be outside in the sun or doing things with my kids. So it got in the way of a lot of my happiness.
Well, since having care with Dr. Durr and Dr. Childs, what's improved?
Well, my neck pain is gone. That was the first to improve. I did a series of treatments, and that took away a lot of the neck pain and gave me back the mobility, and I don't have any problems with that anymore. The migraines have improved greatly, and recently I went an entire month without one migraine, which is the first time that's happened to me in as long as I can remember. So I had a completely pain-free month.
And how is that impacting your life?
It's making my life a lot better and a lot easier. I feel great.
Fantastic. Any other thoughts on your experience at the office, the doctors and the staff?
Everybody at the office has been wonderful. Dr. Durr and Dr. Childs are so great, very friendly, easy to talk to. They really worked with me. We tried several different things to get rid of the headaches, and they seem very caring, and everybody that works here is the same way, and it's a great place to come.
Well, thank you very much for your thoughts, Jen.
Thank you.
All right, I'm here with Cynthia Tier, a patient in our neurologic and metabolic program. How are you today, Cynthia?
I'm very well, thank you.
Good. So what were some of your health complaints prior to coming in our office?
I came to see Dr. Childs and Dr. Durr because I was at the end of my rope. I was completely frustrated with other physicians who could not help me with my complaints, which were stiff neck, numbness in the left side of my face, almost constant headaches, and pain in my back and my hip.
Okay. And how long were you suffering with these conditions?
For the migraines, 30 years. For the back and the hip, 2.5 years, almost 3 years.
All right. And so how did that affect your life with all those conditions you were dealing with?
I can't tell you how many family occasions I missed because of either migraines or my back going out. I was not able to attend not one, but 2 family marriages because I was not able to go physically. It was terrible.
So, since having care with Dr. Childs and Dr. Durr, what has improved?
I have no more pain in my neck. I have no more numbness in the left side of my face. Most important for me, I have no more migraines, which I suffered for 30 years. I was on medication for 30 years for migraines.
Wow.
I was able to discover through an elimination diet that I am allergic to wheat in any form. I do not have celiac disease, and many people ask me, oh, is it because I have do I have celiac disease? No, I don't have celiac disease. I do not have a leaky gut. I have an allergy to wheat in any form, and it is the wheat that caused the migraines all of these years, and no other physician could pinpoint it.
Well, that's great. So, how is all this impacting your life now?
Well, I would like to add that I consulted at least 3 orthopedists about the pain in my hip and my back. I was told many different stories, such as, I have fibromyalgia, and that is what's causing the pain. I don't have fibromyalgia. I was told by several orthopedists that they could not find what was wrong with me, and I was told the last visit was I should sit on a rubber ring, and that would give me some relief from my back. And I came to see Dr. Childs because I came in desperation. I needed help. No one else could help me. I was desperate. I told Dr. Childs that the first time I saw him. And I think you just asked, how has it affected my life?
Yes.
And the improvement in my body and my mind has affected my life in ways that I can't even begin to describe to you, and let me just tell you a few of them. I have no more brain fog, meaning I can think clearly, I can make decisions clearly, I can focus clearly on whatever I'm doing on my jobs. Since I am retired, and I came here after retirement to see Dr. Childs, I believe right now I can now go back to work, get a job, stay focused, earn a living, whereas before, for years, I could not hold on a job. As far as family goes, I am now able to join them in celebrations instead of having to say to them, I can't go, I have a headache. Just last year I was not able to go to a niece's wedding because at the very last moment, while I tried to move a piece of luggage, my back went out. And it was terrible for me to have to lose that time with my family. And even last year, I was not able to travel from Pennsylvania to Washington State because I could not handle my luggage, and I missed my nephew's wedding. And these are only a few circumstances that I can tell you right now that I missed. Now, I can't even imagine having any difficulty going to any family function. I can't even begin to tell you how happy this has made me.
Oh, that's wonderful.
Thank you.
All right. Any other thoughts on your experience at the office, on the doctors or the staff?
I could probably talk to you for at least an hour on how the treatments here have helped me mentally, intellectually, physically. The staff has always been there for me, no matter what the occasion. If I needed something, if I needed help, if I needed direction on what should I do next in the office, if I needed supplements, which Dr. Childs ordered for me, and which basically changed my life in terms of supplements, how I felt nutritionally, the energy level I had. I had no more fatigue. I was able to walk again instead of having to sometimes use a cane. I can now walk several miles a day, whereas before I could not even walk 2 blocks. It has changed my relationship with almost everyone I know. Even though I started teaching French to seniors before I came here, I am able to teach so much more clearly and have them understand me so much better than before, when I was not able to speak clearly to them or give them clear instructions on what they were supposed to do for homework. And also, I belong to a choir in my church. I am so much more able to focus clearly on the music and what notes was I singing, rather than trying to guess on what the next note was. I could talk to you much more about this than before. I speak more clearly. I think more clearly. Before I came to see Dr. Childs, I was not even able to lie on the right side of my body. I could not sleep on the right side of my body. Now I have no more problems with my back. Also, my headaches. I would wake up every single day with a headache. It may not have been a migraine, but it was a headache. The migraines would happen at least twice a week. This went on for 30 years. It was only when I found out that I had a sensitivity to wheat. Once I took the wheat out of my diet, I had no more migraines. It was a miracle. A miracle. People who know me and have known me for a long time look at me, listen to me, hear me, and tell me I am a different person. They don't even think, that they can't imagine that I am the same person. I'm so totally different. They have to look at me twice to see that I'm really me, the old me, and not the me that was always in pain and suffering and missed family outings and always had excuses for why I could not do this, that, or something else, or why I could not work, why I could not hold on a steady job. It's because of coming here and going through the adjustments with Dr. Childs, following the nutrition program, following the exercises that were given to me at home especially. I was able to create this new self for myself, and I am so happy. Thank you.
Thank you so much.
You're welcome.
Good morning.
Good morning. My name is Stu Tompkins.
Good morning, Stu. Can you tell me what health complaints you had prior to coming to the office?
Before coming to the office, I used to get migraine headaches. They were cluster headaches to where they were so severe sometime in a business meeting or something. Many years ago, I would tear in my eye and put your hand on the top of my head, you could feel it was a vascular muscular headache that was unbearable, and it would eventually go away, or I'd probably shot myself. And
How long did you have that, Stu?
for quite a few years. I used to go to some chiropractors years ago to try to correct it, and there was no avail. I'd go in and say, why am I coming here? And they're not doing me any good. But I was introduced to the two doctors here at Corrective Chiropractic, and they didn't only fix me, they took x-rays of my spine and my neck and showed me the results. And after coming in the very beginning religiously, they showed how they improved it, and the migraines went away.
Now, how did those migraines affect your life? How did they affect your time and your happiness, sleep, being able to just get around and do things, and your job and family?
Well, they were unbearable because I could be in a business meeting and they would come on, and it was unbearable to where you couldn't concentrate or do anything. As I said, eventually they would subside, but sometimes it would take an hour, other times it would take all night. And they were severe, and I just couldn't stand it anymore. I'd gone to even a neurologist who supposedly gave me a prescription of some medication, but that didn't seem to accomplish it.
Now, since having care with Dr. Childs and Dr. Durr, what has improved?
Well, I think it's improved to a great extent. I don't get them anymore. I haven't had them. I've been coming to Dr. Childs and Dr. Durr now. I think it's going on 7 years just for maintenance. We used to come religiously in the very beginning until they accomplished it, but they kept me in such good shape. I continue to come twice a month now just for maintenance, and I think I'm doing pretty well, where I'll be 87 next week or next month, and I'm playing tennis 3 days a week, so I give them all the credit in the world. So I think that they're great people and have a great organization.
That's awesome. Are there any other thoughts on your experience at the office, the doctors, and the staff?
Oh yes, the staff is excellent. They've been here for a long time, and they're very courteous and very knowledgeable. The other experience I've had, my son is quite an avid tennis player, a very good tennis player, and a 4 or 5 rating, and he put his arm out where it was like almost a rotator cuff problem, and the orthopedic surgeons he went to wanted to operate. I told him to come out here. They suggested he stop playing tennis for 6 months, which almost killed him, but to make a long story short, they started to work on Bill, and they had him back playing tennis in about 2.5 months, and he's now a very avid tennis player and hasn't had a problem since.
That's wonderful. Well, thank you very much, Stu, for your thoughts.
Anytime. I think the organization is wonderful, and anybody should come if they have problems.
Thank you.